And hello, here's my second take. Um, it didn't. I couldn't finish the rest of it. I think it was almost 10 minutes, and there was some issues on pulling up the X-ray, trying to get it deeper in to look at it. Well, I went to the Porter and Clark place, it's chiropractic. They gave me an X-ray, and she told me, she said you have spatulated L5 RT L or P. I don't know what that is. I think she's saying it's right. It's not. Yeah, it's right or left. It's right. It's a spatulated transverse process. I looked it up, and Bertolotti syndrome popped up, and I kind of looked at it, and I said, "Oh, it's kind of similar." Looked it up on YouTube. I seen a few people with their X-rays, and it kind of looks like it's literally molded on the hip bone. Mine, it's just strictly pinched. If you look, you can see like the fat nerve, and there's no cushion on that right side where the hip is. No cushion whatsoever. So I'm gonna try to get in a little deeper. Here's sorry for that voice crackled. Try to get in a little deeper. There's my stimulator right there to the right. It's kind of unique device. I gotta charge it. I feel like a robot sometimes. I'm zooming in. I wish I could be a little faster. As you see on the left, and this is me standing straight with a straight posture, posing for the X-ray, standing up. Right here is the left side. It looks perfectly fine. The nerve has perfect cushion, near the transverse, and when you look on the right, it's literally glued to the hip. If you look, there's no cushion. There's a little thing of space, like right there. That's not good at all. If you look right here, you have a straight line. And my thing is like the herniations, it would be inside here, inside the spines where you see it pinching the nerve, and that would be more of an MRI would show you that. But I can't get MRIs because the neurostimulator I got, it'll just suck it right out of my spine. And them tubes are attached to the sciatic nerve. Not the sciatic nerve. I'm sorry. Just attached to the nerve root in my spine, near like kind of the upper part near my chest. I probably not that deep, but it's pretty deep. But yeah, if you look, there's no room, and then she drew the red line showing the cushion between this left side. And there's no cushion there. The red line, is being tapped by the, I guess you would call it transverse, but that's the nerve as well. Um, I don't know. I'm kind of confused. I was kind of wondering if anybody can look at it and diagnose me right or properly. I also went to dynamic rehabilitation and looked at it, and they said it's such a new thing that nobody really knows what to do with it yet, how to help it, or how to better someone's life with this condition they get. And with the Berlottis, like I said earlier, it's, you get it kind of later in your later years, but it seems like I got it, like around 19, because my pain just got crazy. It shot up, it just real painful, maybe around 20. I'm 24 now. But it just, I don't know, it's kind of new to me. I'm kind of wondering, trying to figure it out. If anybody could talk to me, give me an update, tell me what their take is, or if they could tell me what you think it could be. Which I got advice from a doctor, and a chiropractor, and a rehabilitation clinic that they said, yeah, it's a transverse. They're even massaging me in dynamic rehabilitation, and I was telling her the spot that's painful, and she says, yeah, that's your transverse. She was rubbing it, and it's like a bone. It feels like a bone right there. And it was way bigger than the one on the left side. And she says, yeah, that's your transverse. There's no doubt that you're not, just talking. It's actually proper, It's actually sounding accurate from what I was telling her through the massage. Because she didn't see the X-ray yet, so she had no idea. And they showed her on Cena, and she said, yeah, that's a transverse. I said, so do you know anything that could help me? She says, no. Unfortunately, it's a new thing, and, everybody's trying to adjust and trying to figure out what could be done with this disease or syndrome. But yeah, if this is my take on my pain and my daily living, it's very difficult. I'm still young, so I'm pacing, my mind's racing, and I'm always in constant pain. I stand a lot more because of this, which I think it's because of that. Um, so yeah, I don't know. If anybody could talk in the chat or just in the comment section to give me advice, I'd greatly appreciate it. greatly. Thank you guys so much.